So there is a demand right now for mental health care in Arizona youth, and Phoenix Children's is saying they are working right now around the clock to try and meet these patients' needs.
And with everything going on in the world, especially when you factor in social media, we have to help these guys out. Experts say that demand outpaces the supply of behavioral health services in our state. And sometimes people just don't do it because of the cost. 12 News journalist Jen Wall joins us live from the studio this morning. Jen, this is an ongoing issue mental health professionals are trying to figure out and get ahead of.
Yeah, absolutely. We just can't talk about it enough. So Phoenix Children says almost 90% of Arizona's communities do not have enough mental health providers, placing Arizona in the bottom third of all states. And it is a big need in our community. The local healthcare system says they're striving to support. Now, a 2021 study showing more than 1/3 of Arizona teens reported having poor mental health. Dr. Funda Bacchini, Division Chief of Psychiatry at Phoenix Children, says the behavioral health community first saw these mental health concerns in youth before COVID, and then it exploded during the pandemic. The combination of stress and isolation making matters worse, Bacchini says. And fast forward to today, the struggles continue. Dr. Bacchini says kids are under a lot of pressure in school and their extracurricular activities, plus they have the added stress of social media. That combination, she says, is more anxious children, many of them seeking care.
So they get very anxious about going to school, for example, and we see kids not wanting to do that. We see kids that are anxious, and have difficulty sleeping. We see a manifestation of physical symptoms because of anxiety in kids that looks like headaches and stomach aches.
So to help with mental health struggles, Dr. Bacchini recommends 13 being the youngest age to allow any social media use, and then parents should monitor all of that use. They say it's really important to teach your kids how to use it appropriately, and then encourage open communication to help with any anxiety. Parents and caregivers can normalize feelings of being anxious by telling your own children about maybe something you're dealing with right now, a personal experience where you were nervous, maybe at work, and then how you overcame it. And then watch for any big changes in behavior in your children and teens, like isolation, increased irritability, and then for younger children's regression. So maybe things like having accidents when they are potty trained. So Dr. Bacchini says parents and caregivers can give younger children something special to take with them, maybe to school or daycare, as a reminder of themselves when they're away. And then for older kids, there are apps like Headspace for meditation. And if you have any concerning symptoms, you can also start by contacting your pediatrician, and they can get you in touch with the experts. But ladies, I didn't even think about using apps for teens. I don't have a teen yet, but I always think adults. So I thought it was really interesting that she said, no, you can use it for the teens as well.
Well, I think that they're so targeted for adults, right, who are under a lot of stress, but you don't think that that stress is passing to them, and they can use that too.
Absolutely.